Okay, so we did chapter 25, Care Across the Continuum. So the way we define continuity of care is quality and consistent health care provided to older adults as they move through various healthcare settings. Healthcare providers need to understand that, yeah, different care is required in different settings. What a person needs in the acute care hospital is different than what they need at home. But this does not mean that each experience should be treated as a separate event. An individual's entire health history and present circumstances need to be looked at by all providers who become involved at some point in that person's care. This is the only way in which continuity of care will be achieved. It's important for us as nurses to provide quality care appropriate for the setting, as well as for the patient's past and present circumstances. We need to facilitate collaborative care with and between other providers so that the patient's needs are fully met. When care is based on the patient and not just on their present issue, rehospitalizations and deterioration in independence can be minimized. In order for this to happen, communication is the key. This includes communication between healthcare workers themselves and communication between healthcare providers and the patient. All those involved need to be on the same page about current patient status, current plan of care, and plan of care for discharge or transition. Part of the plan includes medications. So an example would be medication reconciliation. And other orders or instructions that need to be followed should be known by all providers and the patient. All providers should know about this so nothing gets left out or repeated. Communication with the patient is also of utmost importance. They need to be actively involved in their own care. In order for this to happen, they need to be informed, and they need to be free and encouraged to voice their own desires and opinions about their plan of care. After all, a plan can never be effective if the patient is not on board.
Okay, so whenever you're talking to your patient and their family about what type of place would be best for them to transition to, it's important to consider what type of care they're going to need. There's acute care, long-term care, and more like independent living care. So for acute care, we have acute care hospitals like the lovely facilities we do clinicals at. There's the acute rehabilitation centers, which are good for strokes, spinal cord injuries, amputation, stuff like that. There's also transitional progressive units, which is where the patient's not sick enough to stay in the hospital, but they're too sick to go home. So these units focus on transitioning them home. There's also long-term acute care hospitals where you usually stay for about a month. And then there's home health care, which is good for people with IVs, wound care, newly diagnosed diabetics, stuff like that. So for long-term care, we have the long-term care facilities. And we have Alzheimer's units. And then there's also the Eden Alternative, which focuses on de-institutionalizing facilities and making it more of like a calm home environment. So if you're going to maintain independence, there's adult day services, which is like an adult daycare. They have snacks, well-rounded meals, supervised activities, and they get to interact with people their own age. There's also assisted living, where they're pretty much independent, but they may need some help with activities of daily living. So they might not always need somebody, but if they do need somebody, there's always somebody there. Then there's continuing care retirement communities, where they start off in assisted living and slowly progress to more supervised living arrangements. There's group homes, which are usually in like a regular house with other people, so it provides more of a home and family environment for the older adult. And then there's naturally occurring retirement communities, which is where about a neighborhood or two neighborhoods everybody has their own house, and it's all people who are 65 or older, so that way it's kind of like their own little mini community. So whenever you're looking at your patients' needs and what their main issues are, it's important to consider that whenever you're looking at different facilities that you can help them choose.
So our take-home messages are directly from the textbook, and according to Naylor, take-home message number 1 is that the transitions in setting of care, hospital rehabilitation, long-term care, and the home are considered to be vulnerable exchange points and contribute to the risk of poor health outcomes. So this is just reiterating that. It's just saying that the care that the people get after they leave each facility is going to be of the utmost importance to their outcomes in the future. Take-home message number 2, we're going to use the acronym BOOST, which is Better Outcomes for Older Adults Through Safe Transitions. It's a 30-day intervention that includes pre- and post-discharge interventions. And the 4 pillars of this model are medication, self-management, patient-centered health records, follow-up with the medical provider, and negotiating emergent health concerns and changes in status. So in the future, as the elder population increases, I think we're going to see a bigger evolution in the last one, which is the emergent health concerns and changes in status, because in the future, emergent care is going to be geared more towards the older population or the older adult population.
Okay, to wrap up everything we kind of talked about, patient education is a huge thing when talking and discussing facilities or aftercare that a patient's going to need after a major event such as, surgery, stroke, amputation, new diagnoses, any of those things. It's really important to educate your patient and their families. Promoting independence for your patient is the biggest thing when choosing a facility. It's more about what is going to be best to keep your patient as independent as possible and not what's easiest for the family or for the doctors and the nurses. And if your patient is going home and one of the family members is going to be their caregiver, it's really important to educate the caregiver about caregiver role strain and taking care of themselves and making sure that they're at their best so they can be at their best for their family member.